will have our two last lectures regarding the GI module. We will talk about intestinal infections with parasites. So we are dealing with parasite. We will have two lectures. The objectives of these two lectures to talk about nematodes. You remember the worms I said, nematode, cystode, and trematode.
دكتور
Nematode today, Entropius, Trichurus, Scaris, Ankylostoma, Necator, Stringyloides, and Toxocara. We will talk
دكتور
about. نعم.
مش ظاهرة عندنا الشاشة.
شاشة مش ظاهرة. تمام.
الآن ظهرت.
Okay. So the objectives of this lecture to understand the infection by nematode, I said. These are the nematodes that we are going to talk about them: Entropius, Trichurus, Ascaris, Ankylostoma, Necator, Stringyloides, and Toxocara. We will deal with another group of worms, the cystode, Taenia and Hymenopus. And you remember we mentioned previously another cystode, which is the Echinococcus, you remember. A trematode, today we'll talk about Fissiola. A trematode, previously we have talked about Schistosoma, also another trematode. Today we'll talk about Fasciola. We will talk about life cycle, morphology, lab diagnosis, epidemiology, immunity, and the treatment. These are the themes of the two lectures. We will take the first lecture, then we will have a break for 5 minutes, then we'll continue. Intestinal nematodes, these are cylindrical. Taped bodies, tapered bodies, يعني من النهايات مدببة, اسطوانية, cylindrical, covered with the cuticles, infect about 25% of the human race من البشرية. These worms are Entropius vermicularis, called pinworms, رأس الدبوس. Trichurus trichura, whipworm, that salt, الصوت. Ascaris lambrigoids, large, round worm, long. Necator americanus, hookworm, فيها hook. Ankylostoma duodenale, again hookworm. These two are the hookworms, Necator americanus and Ankylostoma duodenale. And Stringyloides stercularis, the last one. These tables give you the name of the disease. As I said, these are the hookworms, pinworm, whipworm, and the disease Entropius formicularis can cause entropiasis. Trichurus trichura, trichiasis. Ascaris lambrigoides, ascariasis, and so on. Ankylostoma duodenale, remember, can cause cutaneous larva migrans. Very important condition. And I will concentrate on it at the end of the first lecture. The life cycle, how they are transmitted, route of infection, migration, diagnosis. These are the most important, whether there is a free living cycle. Right. Entropius vermicularis, mouth to the intestine. All of them, we diagnose them by eggs, except Stringyloides stercularis can be diagnosed by larvae, which are called rhabdatiform larvae. We will see what is the meaning of rhabdatiform. A free living cycle, all of them have no free living cycle except Stringyloides stercularis, which has a free living uh, life cycle in the soil. And we will talk about that. Starting with Introbius vermicularis, pinworm الدبوسية, threadworm يعني الخيطية, الديزيز يسمونه انتروبياسيس. Adult, we have male and female. They live in the colon and ceca. The female goes outside the anus at night, lay eggs. The eggs are quite sticky. They can be found on the perineum. These eggs can cause itching around the anus. The eggs are infectious to the host and to the surrounding, for example, the family. The eggs can hatch when taken by an individual and release larvae in the intestine, and the larvae become adult within 1 month. The adult worm live for 2 months. And we can see it here. This is the Introbius vermicularis worm, taper ends. And this is the egg. Characterize this egg by one side of the egg is flat. واحد من جوانبها هاي الايج فلات. من تشوف ايج فلات سايد هذه انتروبيوس vermicularis egg. Life cycle, starting the eggs are released, and then these eggs within 4 to 6 hours they become embryonated, taken by mouth, hand-mouth infection, and then goes down to the intestine where they live in the cecum and colon, and become male and female there. Very infectious. This is summary of the life cycle. You can read it, as I said. Manifestation, nocturnal pruritus ani, pruritus يعني حكة around the anus. In females, they can cause genitourinary tract infection. How to diagnose? We put perianal cellophane tape, لاصق, around the perianal area. So the X will stick on that tape. Then we can examine the tapes for X, for ova. Treatment, pyrantel, palmweight, pyrantel, mebendazole, and the individual should be treated and the family members should be treated because it is infectious to the family. The treatment can be repeated in 2 weeks' time, just to make sure a cure has been achieved. ترايكورس ترايكورا whipworm الصوتية. تشوفوا الصوت هون، راح نشوف صورة أخرى. Anterior 2/3 has a thread-like whip. Whip يعني صوت. The tail of the male coiled. You can see the coil of the male. While the end of the female is tapered, straight. Life cycle, this worm attached by the anterior end to the colon mucosa. Adult live in the cecum, release eggs. Eggs mature in the soil, become infective within 15 to 13 days, to 30 days, maybe shorter, of course. Ingested egg hatch in the duodenum, larvae released from the eggs, go to the small intestine, and then migrate to the cecum and ascending colon. زي ما حكينا بالانتروبيوس vermicularis. The eggs here are characterized by 2 knobs زي البكرات اثنين. 2 knobs. This is characteristic of a trichura egg. You can see them here. 2 poles. This is the whip-like. anterior two-third. Again, the eggs mature until it become embryonated, taken by hand-mouth infection, go down, hatch the larvae in the duodenum, go to the small intestine, and then to the colon. And you have male and females in the cecum and ascending colon. Very simple life cycle. This is written clearly here, you can read it, as I said. These figures, the number these days are not important. Epidemiology, infection is associated with defecation in soil. You know, some people in farms, they defecate in the soil. Adult worm can live usually for about 1 year in the intestine, in the large bowel, but sometimes it can extend up to 4 to 8 years. So it's a long time. Pathology, pathogenesis, immunity, they can cause local ulceration and hemorrhage. That is to say, in the colon. And the patient will lose blood and become anemic. Because there is ulceration, secondary bacterial infection can occur to the ulcer, and some of the bacteria will escape to the blood and cause bacteremia. Cell-mediated immunity is important. IgE is important. As you know, IgE is always important and high in parasitic infection. Remember, IgE is increased in parasitic infections, and worms are parasites. You can see here terminal ileum, sometimes escape from the cecum to the ileum. This is the whipworm, a Trichurus trichura. Manifestation, we said there will be anemia, dysentery syndrome. Why dysentery? Ulcers due to colonic damage, and this can cause pain and diarrhea. So Trichurus trichura can cause dysentery syndrome. Because the patient has diarrhea, sometimes you can get rectal prolapse, that is to say, the protrusion of the rectum through the anus. How to diagnose? To detect the eggs. And we have seen the characteristic with two knobs are the eggs. Eosinophils also increase in the blood. Why eosinophil? Is also parasitic infection can increase eosinophil and IgE. Treatment ميبندازول drug of choice. تشوفوا تتكرر الأدوية. ميبندازول drug of choice البندازول. The cure rate is high. Of course, for prevention, good sanitation, prevent people from defecation outside in the farms, etc. This can stop the life cycle of the infection. Ascaris lambrigoides. الاسكارس منتشرة كثير خاصة بالشرق الأوسط. Short-lived, they live about 6 to 18 months, is most common worm infestation. Sometimes we don't say infection, we say infestation for parasite, worm infestation. But if you would like to say worm infection is not wrong, but infestation is better. This Ascaris worm is about 15 to 40 centimeter in length. مو قليلة يعني تقريبا حوالي القدم. Life cycle, we will see it. Immunity partially protective. Because this Ascaris have larvae that can go to the lungs, you will get pulmonary immediate hypersensitivity to the larvae that migrate to the lung. And you get respiratory manifestations. This is the egg crenated like that. السطح مقرنس. Crenated. And you can see this is fertile egg, this is dead egg. You can see it is damaged. This is the scarus, cylindrical, long. So you get the eggs in the feces. You can see the eggs will mature gradually, crenulated until it is swallowed by the patient, goes down to the duodenum, small intestine, hatch there, and the larvae will go through the portal system to the liver and then to the lungs. So the larvae migrate to the lungs and cause respiratory manifestations. Then these larvae migrate up to the bronchi, to the trachea, and then to the mouth to be swallowed again to the intestine where they live in the small intestine. So have extra cycle other than Entropius and the Trichoris. It has pulmonary cycle in the lungs. The larvae go there. Clinical manifestation asymptomatic. If you have a few worms, but it will be symptomatic if you have many worms, which is called worm load. Respiratory symptoms due to larval migration. You get malabsorption, sometimes even intestinal obstruction if you have heavy worm load. You can see this is very heavy worm load. It can cause intestinal obstruction. Diagnosis, you detect the eggs in the stool or in the soil. Sometimes you can examine the sputum for larvae and eosinophils. There will be an increase of eosinophil in the sputum. Treatment, again, albendazole, mebendazole, pyrantyl, palmate. Community mass therapy sometimes may be used for the hormones at 6 months. 6 months. You give a dose today, and then after 6 months, you repeat the cycle. The other type of worms are the hookworms. We said Ankylostoma duodenale اللي منتشرة بالشرق الأوسط. In the Middle East, Ankylostoma duodenale يقابلها في أمريكا Necator americanus. These are slightly different, but both are hookworms. These are pinkish white, about 1 centimeter. The head curved, hooked. A species can be identified by morphology and oral cavity. This is for the specialist. Ankylostoma duodenale have 4 sharp tooth-like, 4 أسنان. Necator americana has dorsal and ventral cutting plates, مثل مقص, plate مقص. The eggs have 4 to 8 cells inside it. Once you see 4 to 8 cells, this is hookworm egg, and we will see it. You can see it. This is the egg, 4 to 8 cells inside the egg. So this is hookworm, and this is the adult worm. Eggs are released. From the eggs, you get larvae, or larvae, they hatch in the soil, which are called rhabdatiform larvae. These rhabdatiform will mature to filariform larvae, These filariform larvae have the capability of invading the skin, and they migrate in the skin and then migrate in the body and they can reach to the systemic circulation, contact with the host. Larvae penetrate the skin, carried through the blood vessels to the heart and then to the lung, penetrate pulmonary alveoli, ascend the bronchial tree to the pharynx, swallowed. The larvae reach the small intestine and then reside there. And then adult worm live in the lumen of the small intestine, and they form eggs which are going to be discharged. Epidemiology limited to tropical areas, of course. Larvae require hot and moist condition. These hookworms have tooth-like cut the intestine or by plates for Americanas, and you get blood loss, significant blood loss. This can lead to iron deficiency anemia. Ankylostoma duodenale, for example, can cause loss 0.2 mil per day. وعدها على الأيام والأشهر. Necator americanus 0.03 mil per day. Adult can live for 2 to 14 years. فإذا أنت تخسر يوميا هذه الكمية من البلد لمدة سنتين أو 14 سنة, you get a lot of blood loss which can lead to iron deficiency anemia. Eosinophilia, any parasite we said can increase the eosinophil in the gut and in the blood. Manifestation of pruritus, skin rash due to the penetration of the filariform larvae through the skin, iron deficiency anemia, and the complications of the anemia. Diagnosis, a stool examination for the eggs, which are 4 to 8 cells. Again, treatment and prevention, pyrantel, mebendazole, albendazole. You have to correct the anemia. And good sanitation can prevent the infestation of the worm, and not to walk bared foot because it can penetrate the skin through the feet. We can continue if you would like. This is the part of the second lecture. We can go through it because still we have time to go through. Now, Stringoloides stercoralis, it has complex life cycle. So we are not going to go into the details of the cycle. You can read it, you can see it, the cycle, but this is the cycle here, okay? So we are not going through the details of the cycle. This worm is only 2 millimeters in length. It is the smallest intestinal nematode. So if I ask you, what is the smallest intestinal nematode? You will say Stringoloides stercoralis. Eggs are not important in the diagnosis because the eggs hatch in the intestine. They don't hatch outside the body in the soil. No, they hatch in the intestine and release the larvae. يعني اللارفا تتحرر بالintestine. فالegg is not important for diagnosis. We detect the larvae. Larvae differ from those of the hookworm, and we will see how they are different from the hookworm. This is the rhabdatiform larvae. This is the filariform larvae. This is the adult worm. Now, when the larvae go to the lungs, also this worm, the larvae goes to the lungs, they will be surrounded by inflammatory cells around them. The primary cycle resembles the hookworm, except the larvae develop in the gut. The filariform larvae can cause autoinfection، يعني تثقب الانتستين وتكرر الحلقة مرة أخرى. Adult can develop in soil and sustain life cycle. You can see it here. This is the life cycle. I don't want from you the detail. This is the filariform larvae. In the soil, they can come adult. This is the filariform. They may penetrate to the intestine again. So just I want from you these words and the previous slides also. Eggs are not important. Larvae different from the hookworms, and you have seen how they are different. Filariform stage in the gut autoinfection, adult sustained life cycle outside. And in the first table that I mentioned, we said Stringoloides have also adult life cycle in the soil. Epidemiology similar to hookworm, but they are less common. If you would like to go into some of these details, you can read the text with this slide. But I don't want from you this complex cycle. Manifestation, it has pulmonary and intestinal because it can go to the lung. The larvae can go to the lung. And it has similar pulmonary manifestation to the hookworm and the scaris. External autoinfection can cause lesion over the buttocks, abdomen, and back. These larvae can penetrate the skin, autoinfection من نفس الشخص. Massive hyperinfection occur in immunocompromised. ولهذا السبب immunocompromised patient should be tested for it. If you would like to give immunosuppressant agent or treatment, you should also test for Stringoloidiasis, because if you give such a treatment, these worms will flourish, will spread more in the body. Diagnosis: finding rhabdatiform larvae in the stool or duodenal aspirate. Sputum examination for larvae. Serology to detect antibodies, especially in subclinical cases by ELISA. So antibody detection is important. Treatment and complicated cases by ivermectin, 2 doses. Hyperinfection, يعني a lot of worms present in the body. Also ivermectin, but we give it for 1 week. In immunocompromised, as we said, the treatment should be used up to 6 months. The cure rate, 100%. This is a case of a child reside in South United States, played barefooted so the larvae can penetrate. Once you hear such a phrase and brought to the physician, and the physician detected that this patient has fever, cough, and wheezing, يعني صفير بالصدر, and he observed 2 small worm-like in the posterior oropharynx, as if it gives you an idea this is Stringoloidosis. Tinea, this is cystod, similar to Echinococcus. تينيا الدودة الشريطية. تينا saginata and تينا solium. Saginata mainly in the beef, في الأبقار. Solium, pork tapeworm, في الخنازير. So Taenia saginata, beef tapeworm, Taenia solium, pork tapeworm. Taenia saginata, as you know, because in the Middle East they use beef, so it is common in the Middle East. Taenia solium common in US and in Europe. Laboratory diagnosis, again, we can use the adhesive cellophane tape to detect the X around the anus. Also, we can detect the X by stool examination, and even we can detect the proglottids, القطع التي تنفصل من الدودة الشريطية، مثل ما حكينا بالإيكاينوكوكس proglottids. بس هون عندنا عشرات القطع وليس ثلاثة مثل الإيكاينوكوكس. This is how to differentiate between Taenia saginata and Taenia solium. Definite host, human. Location in the intestine. The length in meters. أطوالهم Taenia saginata شوي أطول. Attachment by disc. The eggs status embryonated, and they have radial striation مثل خطوط عرضية around the eggs. Intermediate host saginata in the cattle في الأبقار. Taenia solium swine. And the disease that they can lead is called cysticercus. Form cysticercosis can be caused by cysticercus. I will explain it to you in a moment. This is Taenia saginata with suckers. Taenia solium has suckers and hooks. These are the gravid proglottids. You can see it. Of course, there are differences between Taenia saginata and Taenia solium. This is for the specialists. The eggs of both cannot be differentiated. You can see the radial striation of the eggs. هاي الخطوط العرضية بالشell. Okay? And it has 6 hooklet, hexacanth larvae. This is the egg. A treatment, praziquantel or niclosamide, single dose only. Praziquantel, niclosamide. Check after 3 months. Of course, sewage disposal, meat inspection, and adequate cooling. فإذا الأدلت worm of the Taenia lives in the intestine, definite host. And the eggs can be taken by the intermediate host and goes around in the tissues, the larvae, and form cysts in the muscles of the cattle or swine. And these can be eaten by human being. Hymenolopus nana, dwarf tapeworm, القزمة, only 4 centimeter. دودة شريطية بس too short. Transmitted directly human to human. Eggs, fecal oral route. Embryo released, invade the small intestine wall. Re-enter the gut as adult worm. and usually it is asymptomatic, can cause diarrhea and abdominal pain. Treatment as other tapeworms. This is the egg of Hymenopus nana. It's different from the eggs of the tinea. Here there are radiations. Here it's quite large distance between the outer membrane and inner membrane. So completely different. This is the egg of Hymenopus nana. It has the last one is Fasciola hepatica, sheep liver fluke. Fasciola, it is a trematode. Again, we come to trematode. We said schistosoma is a trematode. Adult can survive for decades إلى عقود in the biliary tract. فإذا الفاشيولا تعيش وين؟ بالبلياري tract. Life, I don't, just you can observe it, have a knowledge about it. This is a rare worm infestation. The eggs are quite characteristic, urn-like, okay? Knob on the white side can be detected in the feces or from the duodenal aspirate. Treatment of praziquantel, albendazole as others. This is the life cycle, just read it, but I don't want it from you. Toxocara canis, dog round worm. وطبعا راح نعرف ليش احنا راح ندرسها هذه. Soil contaminated with ova deposited by ova deposited in the soil around children. When they play, they get infection. Infection is more common than the disease itself, the Toxocara canis. Of it, I don't want from you the life cycle because it is almost animal life cycle. Accidentally, a human is infected through ingestion of the eggs. After ingestion of the egg, this can result in a condition which is very serious condition called visceral larva migrant. By migration of the larvae in different tissues. We will see this in a moment. So Toxocara canis is not important for us as a worm. Important to us when it causes visceral larva migrants. So if I ask you, what is the cause of visceral larva migrants? You will say to me, Toxocara canis. What is visceral larva migrants? After the child ingests the eggs, these eggs will hatch and release their larvae. The larvae will migrate through the intestine, go to different parts of the body. And also, can see the life cycle. Here, it can go to the rodent, taken by the dogs release the eggs, etc. And sometimes you get infective larvae may cause penetration of the skin, very rarely. You get enlargement of the spleen because they go to the lung, they can produce asthma and pulmonary infiltrate, abdominal pain. sleep and behavior changes because they migrate to the brain. They migrate to the neurological, to the nerves, and the patient gets neurological defects and seizure, shamra. Also can go to the eye, to the eyes, especially in older children and adult, and cause ocular larva migraine. باختصار, they can go everywhere. They can migrate through the skin also. These larvae, which are and go through the intestine, they can migrate to the skin. So you get a skin manifestation, visceral larva migrans. The condition lasts weeks to months and may result in death. Is larvae ما تخرج من جسم الإنسان. Larvae migrate to different tissues and cause damage everywhere. And there will be no adult worm in a human being because it is dead end host. Dead end host. يعني خلاص. Tissue biopsy, and you can do sero-diagnosis by immunoassay to detect antibodies against the larvae. Treatment, corticosteroid and albendazole. Albendazole is anti-parasite. Corticosteroid just to decrease the inflammation. How to prevent dog, domestic dog, disposal of pet feces, deworming of dogs every 3 months in the first year and then every 6 months. Avoid children from playing with soil. Avoid geophagia. Geophagia, some children, they eat the earth or soil. ياكلوا التراب. This may also assist in the spread of the infestation. Any question?
دكتور عندي سؤال من بعد إذنك.
نعم.
شو الفرق بين الانترميديت هوست والديفينيت هوست؟
الانترميديت هوست هو المرحلة الانتقالية اللي ينتقل بها ويخرج مرة أخرى. الديفينيت هوست where the adult worms lives.
تستقر فيه يعني.
نعم الادلت وورم. من الادلت وورم معناتها هذا هو الديفينيت هوست.
تمام شكرا دكتور.
نعم عفوا. Other question? If you don't have, the lectures are simplified for you. Just read what I have put to you in the slides and you will be very okay with them. Make a small table for you just to remember a few. If you don't have any question, I hope to you all the best in your system examination. وإن شاء الله كلكم بالتوفيق والنجاح.
يعطيك العافية دكتور.
الله يعافيكم.